Hey guys, it's Kayla here. Just gonna start my PowerPoint and my presentation on my periodontal patient. So hopefully you guys enjoy. So first, let's start talking about why I chose this patient. This patient lives in Rangeley, so his commute was really manageable. He literally just would drive up the hill with his four-wheeler and walk into the clinic, so that made it so nice and easy for both of us. And then the other reason why I chose this patient is because he had a really flexible work schedule. It was 2 weeks on, 2 weeks off, which also worked really well with our summer schedule, our summer clinic schedule. So every 2 weeks he would come and see me for about 3 hours. He was willing and cooperative, and the other good thing was that the price was really affordable for him and his family because him and his wife did not have dental insurance. So that made it easy. Who is my perio patient? My perio patient was a male, white Caucasian, about 40 years old. He was married and he has 3 kids. He also is a longtime Rangeley resident. And then his main chief complaint at the time is he wanted to get his perio disease under control, which was awesome, so we could work together and fix it for him. Overall, when it comes to my patient's health history, he's generally healthy. His blood pressure was slightly elevated every time he came and visited me, which he visited me about 5 times. His systolic was anywhere from 120 to 130, and his diastolic was 80 to 89. So I classified him as ASA class 2. And then another big thing when it comes to his health history is that he told me he drinks about 3 to 4 alcoholic beverages a night, and he smokes daily recreational marijuana. My patient had no allergies. He did have a triple hernia surgery in 2016, and there are no other diseases or problems that we should know about. And then I did have to refer, I believe it was my second appointment with him, for a lump under his left neck. When I chatted with him about it, he said that it comes and goes, so we referred that for him. So let's chat about my patient's dental history. The last time a patient told me he went to the dentist to actually get his teeth cleaned was over 7 years ago. We discussed periodontal disease, and when it comes to my patient's memory, he said that he thinks he had multiple teeth removed and extracted due to his perio disease. And then he was really sensitive on his mandibular anteriors, which was important to note when I gave him local anesthesia. He had very heavy supra and subgingival calculus. When I staged and graded him at first, which I'll kind of discuss during our treatment planning, but when I staged and graded him at first, I actually staged him at stage 3 and grade B, but I changed that a little bit, and I'll tell you why later. He did have a partial denture for some missing upper teeth. His family did have a history of perio disease, and his wife also was diagnosed at our clinic a few years ago with perio disease as well. My patient disclosed with me that he brushes about once a day and seldomly flosses. He has very dry mouth, so we talked a lot about that. And then when I classified him for CNCC classification, we classed him as a CNCC class 3, 11 to 15 points. No other indexes were recorded. No adjunct services were recorded either. A big reason why I didn't do, like, for example, Arrestin or laser prior to treatment on my patient was because it was during our summer clinic, and I had not learned how to place Arrestin, and we had not taken our laser course prior to treatment. So I was able to take a screenshot and a breakdown of my patient's ledger that shows every single thing we did when it comes to his treatment plan. As you can see, I have listed here his first 3 appointments. In the next slide, I have his last 2 appointments. So for our treatment plan, I treatment planned him for 5 total appointments. One thing I do want to note here is in summer semester, we had a code for like treatment planning sectants versus quads, and if you see on the top right, I circled it in like pink, it says perio, scaling and root planing 1 to 3 teeth, and under that code it was a sectant. So I treatment planned a sectant for that first appointment because I only got through I think 3 or 4 teeth, so that's why I treatment planned it like that. And then for the future appointments, some of them I treatment plan sectant and some of them I treatment planned a quad. We don't have that code anymore, so it's a little confusing, but it's better now. It makes more sense. The one thing I would change if I could go back is actually just treatment plan a whole quad instead of making it a little bit more confusing with treatment planning the sectants. And then you can also see on here the change of the stage. I first staged him stage 3 when he first came and saw me, and then I actually changed that to stage 4 during the 4th appointment, and I'll explain later why. So here we have the treatment plan continued. As you can see, we have appointments number 4 and appointments number 5. I just wanted to note on here for appointment number 5, this is when the re-evaluation, the 4 to 6 week re-eval took place, which was on August 31st. Appointment number 1. So the first time I had my patient come visit me in the clinic was in May 11th, and here's just a breakdown of his extra and intraoral exam. We did initial medical history. He wasn't on any medications. His vitals were pretty good. Again, his BP here was 124/80, so not too bad. And then nothing too crazy when it came to his extraoral or intraoral exam. Bilat scalloped tongue slightly. The main thing I wanted to point out here, which again was the first time I saw him, he had generalized erythema and localized cyanotic lingual tissue and lingual sectant of 5. It was kind of like a deep purple color due to all the calculus and inflammation. And then his papillas were pyramidal, but his marginal tissue was pretty rolled. Some of it was actually a little bit bulbous from my memory. And then he actually had some general recession we'll talk about when I look at the perio chart with you guys here in a bit. And then, yeah, so this appointment, I classified him as AAP case type 3. When we get to the second appointment, I will explain why I changed him from stage 3 to actually stage 4. This just explains, again, continued for appointment number 1, all the services rendered and his CNCC classification, which was class 3. For patient education, the main thing I wanted to focus on here was that he was only brushing once a day, so I thought it was really important to educate him the importance of brushing at least 2 times a day. And then for our treatment, as you can see, I did start the non-surgical periotherapy in sectant 1, and that's why I treatment planned for a sectant, and then it lists the anesthetic that I used that day as well. So here is his FMX. Just looking at this initially, which I had to have one of the instructors help me because it was actually like one of my first FMXs I did on my own. But just looking at initially with one of the instructors, they kind of showed me the different levels of bone loss he has here, especially in like sectant 5 and honestly sectant 2 too. He has about 3 to 4 millimeters of bone loss, so it was pretty cool to see an FMX of my first perio patient. It explained a lot and helped me actually be able to see the difference between the different stages and grades of perio disease. I was able to complete my first risk assessment on my perio patient during the first appointment as well. So one thing that's pretty important is noting that his age was 40. He's fairly young, so not too old, especially when it comes to like his percentage of bone loss. So when we took his bone loss, which is about 3 to 4 millimeters divided by his age, it put him in the high range of 88 or 0.88, which was high risk for perio disease. And then in addition, which I didn't realize at the time, but when I asked him how and why he lost his teeth, he said from memory he thought it was from perio disease, and he has 9 missing teeth. So that was really important when it came to me changing his stage from a 3 to a stage 4 for his perio disease, because stage 4 is 4 or more missing teeth due to perio. But I didn't realize that at the time during my first appointment, and that's why I switched it when he came and saw me for my second appointment. He had localized bleeding, nothing too crazy. I'll show you more when it comes to the perio readings. And then, yeah, other than that, I just want to make sure you guys note that based off his bone loss and age, he is at a high risk for perio disease. So it was nice to be able to see the risk assessment based off my patient. And I was able to show him this, which I, was able to explain a little bit more, which I think was helpful for him to actually be able to see his information written out and charted. So that was good. So here are the pre-treatment photos that we took on May 11th as well. We took a few important pictures, but I feel like this one was the highlight. I was able to actually, at the end of the appointment, after we got all the pre-treatment photos uploaded before he left, I was able to pull this photo up on the computer screen and show him. Sometimes I think patients just get used to what they're feeling, especially in lingual sectant of 5, it just feels normal to them. So I just wanted to be able to show him his supra and subgingival calculus in lingual of 5. And then the other thing I wanted to note here, which you can barely see it, but right below his supra calc there is the cyanotic tissue and some bulbous and blunted papillas. Here is my patient's perio chart that we did the first day on his first appointment. As you can see here, I think he had about 13 sites of bleeding, so mostly localized, nothing too crazy. And then he had 9 total missing teeth, but 3 of those were wisdom teeth, so we didn't count those for his staging, but I circled here he had number 5, number 8, number 9, number 10, 13, and 18 that were missing. So that is what made me change his stage from 3 to stage 4 due to those missing teeth. And then for his readings, I mean, he had a lot of recession, as you can see, especially in the facial, on the mandible. He had a lot of recession. He also had some local recession and lingual of sectant 5, just because he had, a lot of buildup of super and subgingival calculus. And then on the upper left, he had some pretty deep pockets. He had, like for number 14, for example, he had 6, 4, 7, and then for 15, he had 7, 4, 5, and for 16, which was his wisdom tooth, he had 7, 4, 4. So got some pretty deep pockets there, and that was another big reason why I staged and graded him as a 4 and staged him as a B. Here is my patient's dental chart. So Mainly here just shows again his missing teeth, but then he does have a few composite resin restorations, but nothing too crazy. And then he had a pretty big mesial like chip on number 7 that I just noted. So we made it to appointment number 2, which was only a few weeks later. Like I said, for his work schedule, he had 2 weeks on, 2 weeks off, so that made it nice. So we saw him again on May 25th. The only thing I really want to note here when it comes to his updated EI was I changed his AAP stage and case type from 3 to 4. And the reason why I listed due to 5 or more missing teeth. We made it to appointment 3, which took place on June 8th, a few weeks later. This is his updated EI exam. I think I might have said before in a previous slide that I sent a referral in for the lump under his chin on appointment 1, but I stand corrected. That actually happened during appointment number 3, so that's the main thing I wanted to notate here. One thing when it came to the lump under his neck, which I had one of my instructors feel it and chat with him about it, he says that it comes and goes randomly and then it doesn't bother him, but we still didn't feel that comfortable sending him out of the clinic that day without sending him a referral. I talked to him a few times after that and he said that it's been fine and never really came back, so I don't think anything happened with that, but again, we just wanted to make sure we sent in and scanned in the referral form just to be safe on our end as well. Appointment number 4 took place on June 22nd. Here is my patient's updated EI exam. The main thing I wanted to notice here was the fact that the tissue response from the previous appointment was less erythematous and edematous, which was positive and exciting to actually see. We were able to finish him in this appointment. I was able to place topical, which was really nice for him because he was so sensitive in lingual and facial of sectant 5. And then for patient education here, I was able to clean up sectant 5 really well for him. So there was less sub and supragingival calculus, which, he could see those dental papillas were like blunted a little bit and there was, open contact. So I provided him some interproximal brushes, which were really nice. And I think he really liked those a lot. And then for the next appointment, we set his 4 to 6 reeval on August 31st. So yeah. Appointment number 5. So we had summer clinic, which ended around the end of June, and I unfortunately couldn't get my patient back just with the timing of clinic being over in the summer and then the timing of clinic starting in the fall semester. I couldn't get him back for another 8 weeks, so we didn't do his reevaluation until 8 weeks later on August 31st. Overall, the tissue was less erythematous and edematous, but the main thing that bothered me was since we did wait about 8 weeks, he just had a lot more buildup than I was anticipating in lingual 5, which I'll show you in the post-treatment photos. That's the main thing I wanted to note for the reevaluation, and then also the tissue response as well. So we were able to do a updated perio chart on August 31st, which was really cool to see. I have circled and highlighted in like a purple pink some reduced pockets, which there were quite a few, a lot in upper left, which was nice to see. And then a few in the linguals and a few in the facials, but overall there was a little bit less bleeding, and I would say a handful of spots that were reduced pockets by 1 millimeter. So I didn't, well, here are the pictures for the reevaluation on August 31st again. I didn't love my post-treatment photos. I don't think the lighting was very good. The position wasn't that great. It's really hard to see, but this is the main picture I wanted to show you guys on Lingua 5. As you saw in the pre-treatment photos before, there was so much buildup in calculus and some cyanotic tissue that was like a little deeper purple, bright red, and in this photo you can definitely see the tissue response is better and less erythematous and edematous, but I remember specifically, since it was 8 weeks from me seeing him from his last finished appointment to his reevaluation, I remember seeing quite a bit of buildup, more than, like I said, that I was anticipating, which was kind of a bummer in this situation. But again, I think it was just due to the fact that his 4 to 6 reevaluation was actually 8 weeks, which made it easy for that calculus to rebuild in Lingua 5. Here are some negatives and things I would have done differently. I wish I would have been able to complete like a full quad of NSPT in one appointment. Instead, sometimes for my appointments, which took one extra appointment, I think it took a little bit longer, I only scaled a sextant versus a quad just because I wasn't efficient enough. And then we did 5 appointments instead of 4, which made the process longer for the patients. I really liked my pre-treatment photos, but like I said just a second ago, my post-treatment photos, the quality, they weren't very good. And then the main thing that I wish I would have done differently, but there's nothing that we could have done about it just because of summer semester ending and having an 8-week break between summer and fall semester starting. But I wish I could have had 4 to 6 weeks for my reevaluation instead of 8 weeks due to that quick calculus buildup. And then unfortunately, after my reevaluation appointment, I could not get my patient to come back to see me to save my life, which I knew that he had some residual in Lingual 5, which I wanted to clean up for him. But again, since I wasn't able to have him come back after the reevaluation, I wasn't able to do that. So those are the things I would have done differently. Overall, I think my patient's attitude, like throughout each appointment, was really positive. He asked a lot of questions about his treatment and also was pretty interested in the patient education information that I was giving him and providing him. So that was a plus and a positive. But unfortunately, after the reevaluation, I wasn't able to get his opinion on the full process. Which is okay, but overall, I think my patient had a good experience, and another reason why I know he had a good experience is because throughout his 5 appointments, he was consistent, he was on time, he always came to his appointments, which made it easy for both of us, so that was a good experience. Overall, there are a lot of positives throughout my perio patients process. So, I showed you the before and after perio chart, and you could see that there was evidence of reduced perio pockets, about 1 millimeter, which was awesome to see. And then our pre and post treatment photos showed reduced erythema and edema, which was so cool. Especially there was a lot of there was less cyanotic tissue in Lingual 5, so that was cool. Short appointments, like before the reevaluation, which, like I said, I couldn't get him to come back after, but between each appointments for the 5 appointments, they were short. Time between only 2 weeks, which was really awesome to be able to get through my whole perio patient during my summer semester. My patient was compliant until after the reevaluation, and then I was able to build a really good relationship with my patient. He was awesome. He was hilarious. Told me some funny stories throughout our treatments, which was awesome to hear and get to know a little bit about his life. And then also, The main thing that was the best was I was able to pass off on a lot of my competencies, and then I was able to do a lot of injections on my patient, which was so great. Yay, we made it to the last slide, and we're going to talk about what I learned. So, this was quite a process, and I had a really great time with my perio patient. So even though he didn't come back after the 4 to 6 week reevaluation, overall it was such a great experience. I learned that patients truly do want to make positive changes, which I was able to see in my perio patient by him asking questions and coming to all of his appointments. Time management is key. We have like a million things we need to do in one appointment, but just staying efficient and focusing on time management is really important. Patient education is important. One thing that I learned was, you know, I could talk to my patient all day, every day about making changes, but if they don't truly understand why they need to make the changes, or having them choose to make the changes, nothing's going to really happen. So just making sure I'm thoroughly explaining why my patient needs to make these changes and getting them excited about making them is really important, because like I said, nothing's going to change if they don't understand why they need to change it. And then it's really important because I could catch myself like just talking and trying to explain. But one thing that was really important that I learned throughout this process is listening to my patient's needs instead of me telling them what to do and me talking the whole time, actually listening to them. That's really important. Trust in the process. This is my first perio patient that I completed from start to finish, and throughout the process, I sometimes caught myself like talking negative to myself and saying I wasn't good enough or doing a good enough job, but just trusting in the process was really important, because at the end we did see some positive changes. This is the big one for me, not only when it came to completing, a full perio patient, but just in life, like giving myself some grace and not being so hard on myself, and knowing that it's okay if I leave one piece of calculus or residual. Overall, just giving myself more the benefit of the doubt than not, because we are doing good. And then, yeah, so those are the main things that I learned, which was so great because it has prepared me to hopefully become the best hygienist that I can be here in the near future. Thanks, guys.